Sydney. I'm going to be your nurse for today. I'm just going to go ahead and provide you some privacy. Would you mind verifying your name and date of birth?
Anna Clairbout, 8502.
Awesome. So today we're just going to do a heart, lung, and peripheral vascular assessment.
Sounds good.
Perfect. I'm just going to go ahead and start by looking at your carotid arteries, or carotid, yeah. Perfect. I'd give that a 2+. It's super bounding. Perfect. Also a 2+. And you have a 1-to-2 ratio with APT. Your rhythm of breathing is very relaxed. It's not labored at all. It's a very regular breathing rate. And your skin color is in correspondence to your ethnicity. Next, I'm going to go ahead and just have you take off your shirt. We're going to go ahead and do the heart and lung assessment. First, I'm actually just going to have you turn away from me. And then, just for video purposes, I'm actually going to have you just come a little bit closer. Okay. So, take a deep breath in. Awesome. And then once more, I'm going to have you turn around actually. Yep, just a quick little turn around. Okay, thank you. So deep breath in and out. Perfect. Awesome. The thoracic expansion looked good on both sides. I noticed that my hands were both moving in a symmetrical way and that one wasn't moving far up as opposed to the other, which is a great sign that her lungs are both working properly. Awesome. I'm just going to palpate the front and back for any sort of lumps. Would you mind it rotating towards me one more time? Or either way works perfect. Okay. Awesome. Once more, turn around, please. Thank you. Perfect. Did you notice any pain or discomfort when I was doing that?
No.
No? Okay. I'm gonna go ahead and just auscultate for your lung. Just to check to see if your breath sounds are what they're supposed to be. So each time I move the stethoscope, if you wouldn't mind taking a deep breath, that would be great. Awesome. I'm just gonna have you turn around if that's all right with you. Do you experience any shortness of breath when exercising or just? No. Okay. Awesome. So I was able to hear the typical bronchovestibular sounds. There are no either like crackles, wheezes, rails. Perfect. I'm gonna go ahead and palpate your heart. I also noticed that there were no either like thrills or pulsations, which indicates that your heart is not being overworked. Okay. So I'm just gonna go ahead and palpate those areas. We got the aortic, pulmonary, Erb's point, tricuspid, and then mitral. Later we're gonna find your point of maximal impulse, which is located in the fifth intercostal. So if we count down from the clavicle, it would be like right about here. And we'll go ahead and do that later when we do a table exam. Okay. I'm just gonna take a moment to check your cardiac sounds, your cardiac valve sites, I should say. So this is your apical, pulmonary, pulmonic, Erb's point, tricuspid, and then mitral. And then once more with the valve. Sorry. Atrial, pulmonary, Erb's point, tricuspid, and then mitral. And then just by inspecting on the overall area, I don't see any either lifts, heaves, or thrusts, meaning that your heart isn't being overworked. Perfect. I noted that you have a rate of 67 beats per minute with a rhythm of +2, so very regular. Perfect. You can go ahead and put your shirt back on. I'm pretty sure I won't be needing to check your lungs and heart anymore. Do you have any family history of heart disease?
No.
No? Okay. Okay. So I'm just gonna check first your upper extremities. So I'm noticing, again, your color is really good in correspondence to your ethnicity, and I don't see any lesions or anything. Your hair distribution looks normal. And then I'm just gonna check for clubbing of your nails. Capillary refill is also good. It fills less than 3 seconds. I don't see any clubbing, which would indicate any possible problem with oxygen. Perfect. And then I'm just gonna go ahead and check your radial pulse. So if you wouldn't mind, I'm gonna have you face your both arms. Perfect. Do you ever experience any dizziness when you're at home at all?
No.
No? Okay. Any chest pain?
No.
Okay. Perfect. Both pulses have, they're very symmetrical, and I was able to read a +2 regular rhythm, and then I got a rate of 67. 67 beats. Perfect. So we checked the edema on both your arms, and then I'm actually just gonna have you hop onto the table. We're just gonna go ahead and look at your posteriotibular and dorsalis pedis pulses along with your legs. Perfect. So I'm actually gonna have you lay this way. I'm gonna start, if you wouldn't mind, I'm gonna have you take off your shirt, and then I'm gonna have you lay on the bed, probably facing the camera.
This.
Yeah, that will
Okay,
be
gotcha.
fine. Yeah. Okay. Okay. Perfect. So as we saw earlier, I can have you just roll just a little bit. Okay. So from counting down, it was right about here that it would have been. Hopefully we can see that with the blankets there. Okay. And then I can actually have you put your shirt back on, and then if you want to rotate your legs over on this side, then we can do a leg assessment. Okay. Just palpating for any sort of edema. Looks like you are all good. I don't see any pitting. I'm gonna go ahead and just sneak your socks off. I'm inspecting your legs overall. I don't see any either unequal hair distribution or discoloration. And then capillary refill is less than 3 seconds. I don't see any clubbing at all of your feet. And then lastly, I'm gonna go ahead and just check your posterior tibial and dorsalis pedis pulses. So we're gonna start with the posterior tibial pulse. Perfect. I would rate that a +2. It's very regular. And then on top here, we got your posterior, or your dorsalis pedis. That is also a +2. Now, in some cases, you're not able to quite see your, locate your pulses on your feet, so you are also able to use a Doppler. One thing I also did want to notice or mention is when I did your heart assessment, I was able to hear both the S1 and the S2 of the love dub. So, yeah. Well, thank you.